What qualifies you for cancer financial assistance programs? If you're facing cancer and worried about the costs, understanding what qualifies you for financial help can make a big difference. These programs are designed to ease the burden of treatment expenses and related costs. While each organization has its own rules, there are common factors that determine eligibility, especially for those with testicular, cervical, or other reproductive cancers. Most programs look at three main areas: your medical situation, your financial status, and your insurance coverage. To qualify, you usually need a confirmed diagnosis of cancer. If you have testicular, cervical, or other reproductive cancers, your diagnosis must match the type supported by the specific program. Some programs cover many cancers, while others focus on specific ones. It's important to check whether your cancer is listed as eligible. You will typically need to provide medical documentation from your healthcare provider. This documentation should confirm your diagnosis, current treatment status, and sometimes the stage of your cancer. Usually, it must be on official letterhead and include your name, date of birth, and diagnosis date. Financial need is a key factor. Most programs set income limits, often based on a percentage of the federal poverty level. For example, some programs consider applicants with incomes up to 300 or 500% of the poverty guidelines. You will need to submit proof of income, like tax returns or recent pay stubs. If your income exceeds the limit but you are experiencing significant hardship due to your cancer, some programs may still consider your application. Having some form of health insurance is often required. These programs are generally meant to help with out-of-pocket costs such as co-payments, deductibles, or medications. If you are uninsured, you might be directed to other resources like pharmaceutical assistance programs or state prescription plans. Application processes can vary. Some programs accept online applications, others requiring phone calls or mailed forms. It's important to fill out all forms accurately and submit all requested documents to avoid delays. Since funds are often limited and distributed on a first-come, first-served basis, applying early is crucial. Many programs specify how the money can be used. Some grants are for non-medical expenses like rent, utilities, or transportation, while others may cover medical bills directly. Always review the specific guidelines for each program. For those with testicular, cervical, or reproductive cancers, eligibility is generally similar to other cancer patients. However, because these cancers are less common, some programs may have limited disease-specific support. It's a good idea to check whether your diagnosis is listed or if your application can be considered on a case-by-case basis, especially if your financial need is urgent. To get started, talk to your healthcare team. Social workers or patient navigators can help identify suitable programs and guide you through the application process. Review your insurance coverage to understand what costs are covered and what remains your responsibility. Explore both national and local resources, including government programs like Medicaid or Medicare, which may provide additional support based on your income or disability status. Keep organized records of your medical bills, insurance statements, and correspondence with assistance programs. This will help streamline your application process and ensure you have all the necessary documentation. Remember, patients with reproductive cancers might face unique challenges, including stigma or fewer targeted resources. Being proactive and seeking support from advocacy groups can be helpful. Always consult with healthcare professionals for personalized advice and remember that financial assistance programs are there to support you during your treatment journey. They can help reduce some of the financial stress so you can focus on your health and recovery.